Hi, I'm Dr. Craig Sultan from the Eye Works Optometry in downtown Napa, and this is my friend Pumpkinhead over here, and we're going to be talking about Halloween eyewear contact lens safety. And in case you were wondering, these are not my normal eyes. These are contact lenses that create images for Halloween, and they come in about 25 different varieties. So if you're interested, just call the office at 254-2020, come on down and we'll show you what's available. Today we're going to talk about contact lens safety, how to put them on, how to take them off, and how to make sure they stay on so that we don't injure other people. So to put them on, the hands need to be washed, always be sterile, and we're going to scoop that lens out of the case, and we're going to put it on our inserting finger and make sure that the lens is shaped correctly, bowl shaped, not inside out. So the way to remember is if a lens looks like it's going through the field goal, it's good. If it's off to the side, no good. So we don't want that. So once we know it's correct, we take our non-dominant hand from above, grab those lashes, pull the lower lid down, look straight ahead, watching everything in the mirror with your other eye, and once it goes onto the eye, you let go of the lower lid, look down, hold that position, and blink in a down position. Because if you blink straight ahead, it's possible that you might belch that contact lens right off, and you don't want to do that. So that's how to put the lenses on. And to make sure that the lens is on, what I want you to do is just cover the other eye and say, I can see. Okay, that must be on, put it on, I can see. Because if you can't see, that means that lens is probably on your fingers and you might just do your hair. It ends up in your hair. You get in the car, you start driving and the window's down, and all of a sudden that wind just blows that contact lens out of your hair, out the window, towards the car that's right behind you, and this poor old lady sees that contact lens, frightened as she is, she's going to swerve off the road, and she goes into a ditch and she's thrown her back out, all because you didn't check to see your vision. So, I want to make sure that no old ladies, or young ladies, get injured because of you. And how do we take contact lenses out? To take them out, hands are washed again, and we go in and we pinch the contact lens on the lower third, just like you were going to grab a hair off my arm. You got to pinch and you got to roll those two fingers together, because if you just pinch, you're going to come up with air. So pinch and roll that contact lens off. Now it's in our hand, and before we take it off, though, I have to backtrack. We put the drop of solution in your eye to do it wet, because if you do it dry, you're going to rip the cells off the surface of your eye. So wet removal is the first of the three amigos. Now you have it off, we go to the second amigo, and that is to go straight, young lady or young man, and with solution in your hand, we're rubbing, mechanical rub like a sponge on a dinner plate, and we do the other side. We always do this before it goes into the solution, because if you do the solution first, your lens will not get clean or sterilized, and you're taking the dirty lens next day and back into your eye. Not good. And the third thing is that that case, over a course of a week, builds up a big bacterial count, no matter how well you take care of it. And we want that lens to be sterile when it goes in your eye, not full of bacteria. So what do? Take the case, drop it into a pot of water that's been boiled, take it off the stove, let it sit there for at least 20 minutes, just like you would a baby bottle. And that's how you clean and disinfect your case. And that is the three amigos. This has been eye news that you can use, and signing off, Dr. Craig Sultan and my friend Pumpkinhead. Goodbye.